Clinical algorithms are visual algorithms which help in decision making. If we see an example, how this clinical algorithm will help a young doctor in decision making and stimulate their brain to find out options for a certain management. Let us go to the herpes simplex viral keratitis management. So it takes you to a case of suspected herpes simplex. The ultra short content allows you to see extra content available for the node, and if there is an interlinking with another product. So the same can be searched in clinical reviews. We can come back to this later. Then through a option of zooming in and zooming out, you can see how to proceed with a certain case. And ultra short content allows you to then go into more details of a certain option. If you see the three dots, this is a table for differentiating features between epithelial and neurotropic keratopathy. Uh, Same way, it goes into various treatment options based on the branch that you can take for a certain case. It takes you to that specific measure and how different branches convene and lead to a treatment option. For the part where we have more linkages, if we search this clinical reviews, it takes you to the viral keratitis, which has a jump point of herpes simplex viral keratitis. You can see the topic. So this again is very localized and relevant to the context of India and the developing world. So uh, all the data is definitely reflecting that. So using using the algorithm platform, we can find out how to proceed in this manner. Next part is how to use the practice test. Practice test is something which is not directly relevant to treating a disease, but uh, a practice option which is beyond the disease process, which can lead to diagnosis, treatment options. Once one treatment option has failed, various prognosis and complications, and various follow-ups. So, if we look at USG, which is a ultrasonography technique which can be used in diagnosis at multiple levels, you see that is a practice list of basics of carotid ultrasonography techniques and interpretations. ICU, how to utilize ultrasound in ICU. So same way, supposedly use of biomarkers, which is very prevalent in case of cardiac disorders. So you can see biomarkers for the diagnosis of ACS. So these are the kind of practices which helps you to deliver better care uh, uh, during a treatment process or during a diagnosis process. But they're essentially not specific to a disease. They can lead to multiple options and encompass multiple diseases like we see in this topic. So practices usually have a very specific connotation to their titles, which means that they are very specifically only dealing in one certain problem. So ambulatory management of type 1 diabetes is one such condition which is being discussed. So use of amiodarone, which is a drug in a scenario of a cardiology setting, and how a cardiologist will definitely utilize amiodarone to treat arrhythmias and what to do and what not to do in that scenario. Drug monographs are have been available for essentially all drugs, which is a requirement of approval. But what we have done is to create localized drug monographs, which essentially have a lot of fixed drug combination which are very prevalent in India, and stick to how an Indian physician should utilize a certain methodology. So if you see Augmentin very popular, but yes, other brands in India, Moxikind and Moxclav, they are also very popular. So you can search through them as well, and then it gives you the active ingredients and various strengths available, and then the other options which are more or less standard in terms of FDA rulings. This also allows you to search for drugs based on their brand names in India, more of the popular ones. You can see Zerodol is a very popular brand for aceclofenac. So Zerodol P is aceclofenac for paracetamol, which is an FTC available in India. And when you say Zerodol SP, that means you add the enzyme as well. So a drug monograph with multiple combinations gives you a good perspective into the various strengths that are utilized in that combination, along with the indication and dosage for recommended that combination only. While you can check for aceclofenac, paracetamol, or ceratopeptidase as separate monographs with their specific features, their indication, their contraindications, but this monograph gives you the fixed dose combination of these three, and then how to proceed when prescribing these tablets to patient. These are the three content types and their features to be utilized.